Hey everybody, welcome to Implant Dentistry and Case Acceptance Chips. My name is Paul, Dr. Nacho Goodman. This has been an amazing series. If you're watching this live, you're going to be able to earn live CE. You'll be able to ask questions in the chat. If you're watching this on demand, just shout the questions at your TV. Maybe I will hear them. Just kidding. You can text them to me at 215-543-6454. Before we start our show, I want to share one of our amazing key resources and sponsors, Stern Gold. Whether you're doing implants or composite, you need tools. If you're going to play golf, you need golf clubs. And with our implant dentistry and case acceptance chips, our goal is to bring you resources. We have the awesome Dr. Hallas joining us before we start our show to share the TRU and the PUR Implant System from Stern Gold, how he uses them. But first, I want Dr. Hallas to share with us, what do you do as a dentist, Dr. Hallas? What is your everyday dentisting life, and where are you located here on Earth?
On Earth, I'm in basically Green Bay most of the time, and then I have two practices in the UP of Michigan as well. So we have a little bit of windshield time, but generally in the Midwest.
You're a multi-practice owner, which can be quite awesome, but also make you feel like this sometimes. It's, Mr. Grumbly, so it's the ups, the downs, just like dentistry. So multi-practice owner, and share with us before we talk about Stern Gold, PUR, and TRU, what do you do with implants? When did you get involved? What's your journey been like?
Journey started in my PROS residency, 2007. We placed implants, restored implants. From there, I basically came out and practiced in implant-based practices. And then our practice focuses on implants, implant rehabs. I mean, we have the CT scanners, we got, all the toys to place implants.
Awesome. I mean, there's been quite the evolution. I finished in 2002, finished my residency, had a multi-year GPR. Tonight, we're going to have my awesome friend and also surgical prosthodontist like you, Dr. Rob Slough, present. Call you guys kind of the superheroes of implant dentistry because you can do so many different parts of it. So in your everyday life, first share with us the Stern Gold, TRU, and PUR system. How are you using them? And share some of the advantages some of the people watching in might enjoy as a general dentist or specialist placing implants.
Our practice is unique because we are a fee-for-service. I don't participate in any insurance plans. So that's a good thing and a bad thing, right? Some of our treatment plans could approach, 6 figures when you really look at full arch, big implant reconstructions. So you can't really negate other patients. So Stern Gold is an adjunct in my practice as a value-based system. Specifically, I use it for, single posteriors, overdentures, in order to hit key areas that you might miss that are actually very doable cases and have a lot of benefit to the patient.
I think that's great. And I think, everything that we do, we've been dentists for about the same length of time. I don't think there's any such thing as practice management or clinical CE or business CE or leadership. It's all the same thing, right? A clinical decision affects business. A business decision affects clinical, just like playing a game, playing around a golf. And this is a good tool for you to use as a fee-for-service prosthodontist. Tell me a little bit about their convenience bundles and how that helps.
It's interesting, right? I have extensive training. A lot of us do, right? But when you look at the parts, the pieces, it's not that complicated. But if you're new, coming out of school, kind of like your video said, doing a denture in 17 visits, I mean, it used to take us, 4 or 5 to do a crown. Yeah. And then all of a sudden you come out and it's like, all right, what do I need to place the implant? What do I need to restore the implant? What do I need to get the implant seated? Do I need an extra prosthetic screw? What kind of impression coping do I need? So the neat thing that Stern Gold came up with, really led by Patrick, one of the key people at Stern Gold, was a all parts included package. Yes, awesome. It's basically start to finish. It has the implant, it has your impression post, it has your scan body, actually, if you have a digital scanner. It has a tie base to do a full contour zirconia crown, all for $95. So it simplifies everything in one place. So your assistant, who probably will go nuts trying to find stuff normally in a 300-page catalog, has to just click one product.
I love that.
That's really simplified.
I want to share what we're talking for people. One of my things is awareness, attention, just find out momentum. To find out more about what Stern Gold does, just text Stern to 55444. My awesome team will drop it in the chat here. Find out as much as you can about things that will help you as a denting individual. I love talking to you, Dr. Hallas. I have this guy here because I say, what do we try to do as dentists? Not cry on the inside, right, during our day, by developing our dental core, our mind, our words, and our hands. It's been the foundation of this course using implants. So we talked about the convenience bundles. Now let's talk about, when I finished my dental school and even residency, there weren't that many implant brands on the market. There's only a handful. Now there's so many, and there's parts and there's pieces. What's some of the advantages using the TRU and the PUR for the equivalence to other systems, or how can you compare it to that?
So what's neat about the Stern Gold is it's equivalent to another implant system. So it has in the TRU, it's a Nobel compatible connection. So part of the reason why I use that in my practice is I use a lot of Nobel BioCare. We use a lot of Stern Gold. So now I have one restorative component, two different implant systems that allow us to kind of create value where we need.
And I think that's a really important point because, doing implant casing, I'm going to show a case in the beginning to share with my good friend Rob of a full arch case I did years ago. Keeping track of parts and pieces and having all that can be challenging. The way to streamline it with connections that can be used in multiple ways, even just screwdrivers that can be used in multiple ways, is so advantageous. As we talk a little bit more, they're made in the USA. What's the importance of that, or how does that factor in for a dentist like you?
When you think about it, we're placing a titanium pin in somebody's body. So you have to have traceability. You got to have product guarantees. You got to have a company that stands behind it. So when I look at stuff, I want to know that it's a quality product that I could rely on. And if there is a problem, the company's going to be behind it.
Yeah, those are awesome points. I appreciate you sharing. And as we wrap up and we text Stern again to 55444, you've shared some great value with us, how you got into implants, where your journey's going now, business stuff. This course was designed, implant dentistry and case acceptance chips, for anyone on the journey could gain value, but really for people starting out, newish dentists who say, do I want to place implants or just restore them? Do I want to place some? What advice would you have? Talk to a dentist 2 years out of a GPR with the implant. What advice would you give them now? What courses would you take, or what would you focus on?
To me, implants are truly standard of care and an option, right? And as general dentists, we can do anything you want, right? And then you can refer the more complicated cases to a specialist. So I feel implants are going that direction. There's no reason why a general dentist can't do a posterior single implant, an overdenture, and then work with this specialist on more complicated cases. So my goal would be to find a mentor truly that's in your area that can help develop your skill set, but also be an ally and a resource.
That's great advice. And what drives me a bit Nacho nuts is with pedo, you do some, you refer some. Endo, do some, refer some. Implants, I feel, should line up with that so that specialists do more cases, general dentists do more cases. So these people win. And these are the most important people. Your patients win. When there's more awareness and you're talking about it more, you see more cases. And when you can refer some cases and do some cases, you become more implant aware. So I appreciate you sharing that with us, Dr. Hallas. Thanks for being an awesome advocate of implants, sharing with us the Stern Gold system. Text Stern to 55444. You've been on Nacho Zoom TV before. We hope to have you back again in the future.
I appreciate it. And now it's time for Hot Wheels. I'll talk to you guys.
Perfect. Have a good time.
Thank you.
Awesome.